Hello, this is Dr. Gay from First Look MRI, and this is a 53-year-old female who complains of lateral elbow pain. And on this view, on the right, it is a fat-suppressed view, so fat is dark, muscle is more intermediate, and fluid is bright. So the marker stands out as bright here. It's a vitamin E capsule, and we see fluid in the joint. So they have a small joint diffusion. This is the radius, this is the radial head, and this is the humerus here. The other bone over here is the ulna. This view does not have fat suppression. And now we're going to look at the medial side. So the inner side of the elbow is right here. There's a bony protuberance called the medial epicondyle, and there's a dark band here. This is the common flexor tendon group. All the muscles on the medial side come up and form the common extensor tendon. It attaches here on the medial epicondyle, and that looks dark and uniform and nice. So this looks normal on the medial side, but the lateral side, where we have the marker indicating pain, is abnormal. So by contrast, you can see that the outside here is not really dark. It's gray, intermediate in signal. This is a normal tendon down distally. The common extensor muscle group here has a central tendon that comes up, and the tendon looks pretty normal here, but when we get close, it becomes too thick and really gray. It looks just like the muscles. It's so thick and inflamed. On this view, with fat suppression, we see that the common extensor tendon is diffusely thickened. It's much too large, and there are some streaks of brightness. This is a hypertrophic tendinopathy, meaning it's inflamed chronically and enlarged, and there are some streaks of inflammation. So not completely torn off, but definitely chronically inflamed. So this is a case of lateral epicondylitis, more of a chronic or acute upon chronic lateral epicondylitis, but no complete tear and no tendon retraction. And again, the medial side, by contrast, looks nice and normal. So lateral epicondylitis in a 53-year-old female.